Welcome to BSU Sings News. I'm your host, Dr. Joe, and in today's episode, we're discussing methods for maintaining your vocal health. We'll cover a few everyday habits that are important to keeping your voice healthy, a few tips and tricks for keeping that voice healthy before a performance, and give a few strategies to help deal with any hoarseness or swelling that can happen sometimes when we get sick or overuse our instrument. Let's get started. And now for some daily habits that are important to cultivate as a singer. Get enough sleep. You may be hearing this advice about all kinds of aspects of your life, but for singing, sleep is crucially important. We spend our whole day using our instruments, speaking and singing. Sleeping allows your voice to repair and recover from heavy usage. Getting exercise. Your body is your instrument. Strengthening your core will only help you support your voice better, and staying active is especially helpful for moving congestion when you're feeling phlegmy. Eat healthy foods. Know your body and avoid food and drink that give you heartburn or indigestion. A healthy body is a healthy instrument, is a healthy voice. Stay hydrated. Drinking throughout the day will keep your vocal cords lubricated, increase your vocal stamina, and hydrate your tissues so that they are less vulnerable to wear and tear. Develop a daily systematized vocal warm-up routine. Mastering anything in life requires diligence and regular practice. When your voice is in shape, it's also less vulnerable to injury and fatigue. Now, a special story from our lead reporter, Dr. Joe. Everybody reacts differently to their nerves when they get anxious for a performance. Those nerves can cause very real physical symptoms that can significantly affect the voice. It's important then to know how to cope with those symptoms so they don't get in your way. Some people get phlegmy, almost like an allergic response to their nerves, while others get dry mouth. I'm a dry mouth kind of person. Knowing that about yourself can really help when you're preparing for a performance. If you're the phlegmy type, you're going to want to avoid things that cause phlegm when you eat. So no dairy products or anything oily or very fatty just before you perform. Instead, try drinking lemon water or eating slices of tart green apple to cut through the phlegm. If you're the dry mouth type, eating fatty or oily things can help a lot, and you won't have to avoid dairy products. You can try eating a slice of sweet red apple or anything that causes you to salivate just before going out on stage. Hydrating is important, but doing so effectively is not just about how much you drink. It's about when you drink water. Drinking large quantities of water right before you go out on stage can actually make you drier because it washes away all that lubricating saliva or spit out of your mouth and off your cords. Instead, steadily hydrate throughout the day before your performance. And if you need to drink shortly before you perform, take little sips. Thank you, Dr. Joe. Excellent reporting. In other vocal news, sometimes you may experience some hoarseness or swelling on the vocal cords. Now, this can be caused by a variety of things. By a sickness that causes irritating congestion, by laryngitis, which is a virus that causes swelling on the cords, or by overuse of the voice. You'll know you have swelling if you are hoarse, meaning you hear air in your tone as you sing. If it feels difficult to produce sound, or if there's a delay when you try to start your sound. Here are 3 tips on how to deal with vocal fatigue, swelling, or hoarseness. Up next, vocal remedies with Dr. Joe after the break.
Do you find your voice is tired after a long day of speaking and singing? Are you shouting at athletic events or concerts to show your support? Clap harder or learn to whistle. Never scream. For those days your voice is tired from sickness or overuse, try out mint or peppermint tea bags. You'll find it soothing whether you drop it in your mug of hot water to drink or in the bowl you're steaming over. Available now for 3 easy payments of listening to your teacher. Call now at 1-800-BSU Sings. That's 1-800-BSU Sings.
Never shout, never scream, but when your voice is spent, try a tea bag, mint or peppermint.
Welcome back to BSU Sings News. It's time for our segment on vocal remedies. Warm down after a long rehearsal or performance. You can do this with a bendy straw and a water bottle. Singing into the water in your speaking range for 5 to 10 minutes is a well-known therapy technique for taking down vocal swelling. You'll know you're doing it right if it feels easy, and you can feel your voice buzzing in the straw, not in the back of your throat. Go on vocal rest for 24 hours. This can help you recover from overuse or illness. If you find, however, that you're regularly hoarse, that means it's the way you're singing that is causing the problem. Vocal rest then won't help you if you have chronic or repeated swelling. You'll have to change the way you sing. Use vocal rest to help with acute or sudden swelling. Steam for 10 to 15 minutes with hot water to soothe the swelling. Boil some water, pour it in a bowl. Then cover your head and the bowl with a towel so you're trapping the steam in against your face, like this. Repeat for 10 to 15 minutes as many times as you need. Back to you, Dr. Joe. Thank you, Dr. Joe, for those demonstrations. Remember, your body is your instrument. Take good care of your instrument, and it will serve you for a lifetime. With BSU Sings News, I'm Dr. Joe. Thank you, and good night.